I'm called upon the next presenter, Ms. Annie, going to present on the topic of factors contributing to high prevalence of adolescent pregnancy in Sheshik district, Zambia.
Hello.
Hi, Ms. Annie. Good morning.
Good afternoon.
Good afternoon.
Yes, greetings to everybody. Yeah, my name is Mtonga, a PhD public health student at Texila, and I'm going to present the findings of the factors contributing to high prevalence of adolescent pregnancy in Sesheke district, Zambia. Sesheke district is located in the western part of Zambia, and I did this study because of a concern in the number of adolescent pregnancies in that area. So in terms of the abstract, the aim of the study was to investigate factors that contribute to the high rate of pregnancies among adolescents in Sesheke district of Western Province. The study design was a combination of quantitative and qualitative approaches using a triangulation mixed method design. The method was able to concurrently collect both qualitative and quantitative data, which was processed, analyzed, and interpreted. Key findings of the study were that the main factors contributing to the high rate of adolescent pregnancy in Sesheke were peer pressure, adolescents don't take advice from anybody, love of money, lack of knowledge on how to prevent pregnancies, and being involved in bad behavior in that order. Other factors were shyness in accessing reproductive health services in the presence of elders, poverty, and also being forced into early marriage and wanting to experience the sexual debut following attainment of menarche, and lack of knowledge on the use of contraceptives. This slide is showing the map of Zambia on the right with all the districts. Zambia has about 116 districts as of now. And on the left side, you have Sesheke district, which is also being shown in relation to the rest of the map of Zambia. So in terms of the factors contributing to the rate of pregnancy, high rate of pregnancy, the responses from the adolescents listed peer pressure as number one, which was at 25.4%. And the second point was they do not take advice from parents or guardians. The adolescents do not take any advice from anybody, especially from the parents and the guardians. And love of money came in as a third with 10.2%. Lack of knowledge on how to prevent pregnancies was 10.2%. Involved in bad behavior was 9.6%. And shyness in accessing reproductive health services in the presence of elders was rated at 9%, and poverty was 5.6%. Then also the other factors were that parents or their guardians don't encourage them to go to school, and that was at 5.6%. And this kind of thing happens mostly when they are also boy children also expected to go to school. The preference would be to send the boy child to school, because it is assumed that the girl is going to get married and she'll be okay. And then the other factor was desire to experience the sexual debut after experiencing menarche, which was at 4.5%. And this is related to the initiation ceremonies that take place once a girl reaches of age, the age of puberty. Lack of knowledge on the use of contraceptives was also cited, and forced into early marriages. As I said earlier on, when they cannot afford to send the girl to school, they will just choose to send her to school. Just send her to get married, and that contributes to the rate of early pregnancies among adolescents. From the point of view of the nurses and midwives who were also interviewed on the factors that predispose adolescents to have early pregnancies, the first point which came out was that of peer pressure at 33%. And also for being forced into early marriages was at 16.7%. Poverty was also listed, just like it was mentioned also among the adolescents, and lack of parental guidance, because it was assumed that most of these girls who get pregnant are not guided by their parents or guardians. And the nurses and midwives continue to say that there is also a lack of recreational facilities in their areas because they have nothing to entertain themselves, no places to entertain themselves. There's also lack of information on sexual reproductive health and lack of information on their rights. They do not know that they have a right to go to the facilities if they wanted to do so. And from the perspectives of the adolescents, the parents and the guardians, their statements were that it's annoying to parents when a girl gets pregnant, and others said it's a shameful act, and others say it shows the lack of family planning, which means that even the parents, they know that there is such a thing as family planning, but they don't just discuss it. And then children do not follow advice given by the elders. Adolescent pregnancy is a normal thing here. So to them, especially in the rural areas, because Sesheke is one of those rural districts of Zambia. So this statement is not surprising when somebody says adolescent pregnancy is a normal thing here. Reflects lack of information, and it's also a failure to abstain from engaging in sex. So when you look at the key findings as presented here, they are under the column of adolescents, under health workers, and parents or guardians. So peer pressure stands out also under adolescents and also under health workers. But also the parents they say that they lack knowledge on contraceptives. That's what they say. So the adolescents do not take advice from parents or guardians, and then there's love of money, and there is also lack of knowledge on how to prevent pregnancies, and they are also involved in bad behavior, shyness in accessing reproductive health services, as earlier said, poverty, and also that parents do not encourage female adolescents to go to school. Also, the wanting to experience the sexual debut after attaining menarche, lack of knowledge on the use of contraceptives, and also adolescents being forced into marriage. Those were the factors according to how they are listed under the adolescents. As for health workers, as I stated earlier on, it's peer pressure, being forced into early marriages, poverty, lack of parental guidance, lack of recreational facilities, lack of information on sexual reproductive health, lack of information on their rights. So if we go back to the parents, the first one is that some parents or guardians lack knowledge on contraceptives. Some parents or guardians do not discuss issues related to sexual reproductive health due to social cultural restrictions. And then there's low income levels in most of the households that lead to some parents or guardians forcing adolescents into early marriages. And then lack of knowledge on how to prevent pregnancies still comes up. So when you look at the recommendations based on these observations, I indicated there that in order to reduce the high rate of adolescent pregnancies in Sesheke district of Western Province in Zambia, government and all relevant stakeholders should enhance their programs of promoting the girl-child education through the following measures. One is to sensitize adolescents on the dangers or complications of the adolescent pregnancy. And in this case, young nurses and midwives should be deployed to interact with adolescents in the youth corners of the health facilities and in the communities. The second point under recommendations is that we should utilize existing community support groups to encourage parents to interact with their children so as to create awareness to the importance of preventing adolescent pregnancies. Thirdly, we should enhance nurses and midwives' education on sexual reproductive health, especially on prevention of adolescent pregnancy, and to provide information on the concept of abstinence, because they don't talk about abstinence as far as the pregnancy is concerned. So this is why I personally feel that this is a concept that needs to be promoted, especially for this group of the adolescents. Then sensitize parents and guardians on taking advantage of the re-entry policy to support their children to complete their education. The government of Zambia introduced a re-entry policy whereby the girls are encouraged to go back to school, but some parents do not support that because they consider it as a burden to remain with the children. So this is why it is important that they are sensitized to understand the importance of their children completing their education. Enhance comprehensive sexual education for the girl child to continue learning and complete her secondary education so as to reduce poverty levels in the communities. And then also during school holidays, engage adolescent girls in some recreational activities to include life skills, which can assist girls to become more assertive and able to support themselves through their education. In terms of acknowledgements, I would like to acknowledge my mentor, Ms. Jessna Melin, for her immeasurable help, advice, encouragement, and guidance during the period of the study. And I also acknowledge the encouragement and guidance from my supervisor, Professor Grace Cecilia Msonda-Kahenya, and my data manager, Mr. Ivan Skangwa, Senior. All these are greatly appreciated. In summary, in this presentation, I've discussed factors contributing to high rate of adolescent pregnancy in Sesheke District, Zambia, and also discussed some recommendations that could complement government and community strategies to curb the high rate of adolescent pregnancy in Sesheke District. I'll be quite happy to get some suggestions from the listeners in the questions and answers as well, so that we can learn from other people what they are doing in their countries. Thank you very much.
Thank you, Ms. Annie, for your grateful presentation.
Thank you.